Hi, we're here today at the Center for Reconstructive Dentistry with Dr. Alon Frydman, who's a clinical professor in the area of periodontology at the University of Southern California. You know, there's so much talk about nutrition today, and we used to have so much pasta in our diet, and now we have low carbs and high protein and more acidity. And there's such a big talk about acid reflux and nutrition. How do you feel, as kind of a gum guy, how does it work for the overall health of our gums and teeth? Because if our gums aren't healthy and we have acid, there's going to be problems. So how do you deal with it? What are your current thoughts on this?
Well, when it comes to acid reflux and sort of acid bath for teeth, that's typically been the majority concern for those types of patients. When you have acid reflux and the acid comes up into your mouth, it will generally pool in the lower teeth. And being that it pools in those areas, we know that acidity causes demineralization of the teeth, and the demineralization leaves those teeth susceptible possibly to caries and cavities. Now, in relation to the tissue, it doesn't have as much of an effect. It's not such as a high acidity that it causes a chemical burn, which is something we might see in the tissue. So it's not something that we are affected by directly with the tissue, but in a way that we are affected in that it's leading to more tooth loss in some patients. And in some cases, patients who have dry mouth related to the medications they're taking, along with acid reflux, you have dry mouth, you have acid reflux, these patients get more caries, they end up having teeth that can't really be restored by the doctor, and they end up losing teeth. And that's why we're finding some patients having to have more implants placed, which is not necessarily the best situation. You want to keep your teeth as long as you can. Obviously, implants are the best option that we have when teeth are lost. But if we can keep teeth, obviously that would be better. So my recommendation, in order to avoid having to have more and more procedures done, is actually, again, to work with the medical doctor, try and find something to control the amount of acidity. We have the tools of using fluoride to help combat that loss of mineralization. We have also the opportunity to sort of educate the patients, because we see patients more often than they go to their medical doctor. We have set recalls. So those are times when we can sort of say, hey, you know, maybe the medications aren't working out the best because we can see some effects on the dentition, and we can possibly refer back to their medical doctor. So we can help to be sort of early detection types of people who are in these patients' lives.
You know, and it's amazing because so many medications that we take today do cause dry mouth, and so many people's diets are more acidic. And there's been a lot of talk about the alkaline diet and many books written about it. And sometimes what we do is we'll have patients get pH balance strips or acid base strips from the health food store and put them in their mouth frequently throughout the day and keep a log of that for 10 to 15 days to see what the oral cavity is doing when it comes to an acid-base situation. And then if we do find a strong acidity, we'll then refer them to either their ENT or GI doctor to be assessed in that manner, because, you know, as we see, so much acid in the head and neck area can lead to different head and neck cancers, and then they can have a very terrible result. And I feel that I feel that I'm seeing much more of it in my practice, but also the statistics on head and neck cancer have gone up so much over the last few years. Taking a preventive approach on, you know, kind of the acid-based alkaline type diet, I think is really important to the oral health and really the overall health of the body.